Hi Charlotte, thanks for filling out the request for a video. Um, it sounds like there's quite a lot going on. I- it looks like sort of at the moment the big problem is waking up with the pain between the sort of shoulder blades and up into the neck, and the sort of throbbing pain on the sort of front of the hip. Um, I think certainly you could have had a disc that was pushing on the nerve. Most get better without a need for surgery, and if it was sort of down the leg and causing sort of pins and needles or numbness and nerve pain, shooting pain, that sort of thing, then it could well have been a disc that sort of you've recovered from. I think trying to work out why it's still there would obviously be an important thing. I don't know if that's how it always was, that it was sort of in the front of your hip, or if it was right down the leg. Often, I mean, obviously a disc is in the back, so you'd normally expect there to be some sort of discomfort in the back, or something like that starting it, and then the sort of symptoms into the leg become the more sort of the bigger problem. So probably trying to sort of help sort of understand what's going on with that, and see if it just needs some rehab work to sort of gently loosen off the front of the hip and get you sort of moving it again, or if it's a sort of separate problem, or in fact it wasn't a disc. I think it sounds like you've had quite a few people suggest that possibly you're hypermobile, and that I don't know if it's been explained, but widespread pain is often sort of associated with hypermobility. That would probably sort of, yeah, help us understand a bit more why the sort of knees, the back, the sort of shoulders from a young age and stuff like that. Um, I think what what it sounds like we sort of focused on is the upper back and neck, and sort of I suppose what the things that you've mentioned, the sort of swimming and Pilates that you want to get back to. For me, they're the most important things, because um, no one else has got your life, and getting you back to the things that matter to you is the sort of most important thing. So that's sort of what we'd fix our sights on, really trying to get back to that. With hypermobility, if this is a sort of underlying sort of thing that's going on, which is probably going to have an impact on all the sort of symptoms that you get, because there's lots of mobility in the ligaments around the joint, it relies on the muscles to work a bit harder. So what you quite often find is you get quite a lot of muscle tension around the body as a result of that. And sort of, if there's any weakness that might have happened if you were sort of off exercise for the disc and pregnancy and sort of aftermath of that, then we tend to get weaker, and weak muscles, you might imagine that everything just sort of like is floppy, but it's not really the case. When muscles get weak, they tighten up to try and restrict movement. So I dare say we'd probably find quite a bit of tightness in the upper back that could do with being addressed, and we'd always look at sort of like, what can we do to help address it? But more importantly, how can we sort of get you doing things that you can sort of see value in, that are easy to sort of put into your life, that actually stop it from coming back. So you're not, yeah, reliant on coming to see us forever. So yeah, I think it might be best to book in for a suitability call. I'll put some links in the email I'll send, just to have a chat about it, so I can sort of probe a bit deeper on the sort of questions around what's going on, because I said there seems to be quite a lot going on. I'd say the hypermobility is probably going to have a role to play in what's going on with you, but I mean, lots of people have hypermobility, and not all of them wake up with daily pain. So I think there's certainly something that can be done about the upper back pain and neck, and then trying to find a way to sort of make sense of what's happening with the hip, so you've got a bit more of a watertight understanding of what's happening with it, on sort of diagnosis, and then find ways and strategies for you to sort of get on top of things a bit and get you back sort of, yeah, swimming and into Pilates, that'll probably be the sort of where you're sort of the off ramp for me, or essentially where you're left sort of happily sort of swimming and doing Pilates and sort of self-managing. So I hope something there's sort of useful, and as I say, I'll put a link to suitability call, which might be a better way to do it, and I'll probably have some space on Monday where I could have a chat with you. Bye bye.